A very big reason people are living here today is for the sole purpose of healing others in need.
We don't walk at it alone. It's a magnificent blend of individualistic people with extraordinary abilities, all joining in to heal the world together.
And since all of us have the ability to heal, there must be a way to tell the world all about it.
Welcome to the Healers Podcast.
It was the year 1996 when I got introduced to this incredible treatment called ECP. Right away, I noticed that people were getting better from this amazing therapy. You lay down on a comfortable bed and 3 blood pressure cuffs are wrapped around your calves, your thighs, and your buttocks. And to the rhythm of your heartbeat, these blood pressure cuffs start to squeeze the blood from the lower extremities and move the blood throughout the whole entire body. How many of us want to prevent and reverse cardiovascular disease without medication and without surgery? Heart disease, stroke, diabetes, high blood pressure, high cholesterol are all circulation inflammation problems. They are not genetic. This is a lifestyle problem. The great news is we can prevent it. We do prevent it at Global Cardio Care, and we do reverse it. What does it do? Grow new arteries. For people that have blockage of the arteries of the heart and the brain. For people that have high blood pressure, it reverses hard arteries. For people that their organs are no longer functioning, it repairs, rejuvenates, and restores. FDA cleared, no medication, no surgery.
Little introduction.
Our big audience.
The big audience that you can't see, but they're there anyway.
They're there.
That's always a fake audience on Hollywood anyway, right?
Totally.
Pretty much.
Yeah, exactly. So, welcome to the Healers, everyone. My name's Logan.
I'm
We
Gabrielle.
have Gabrielle, the lovely host Gabrielle, and our amazing guest,
Sara Soulati.
Sara
Soulati. Such a beautiful name.
It is.
so
Do you have a
much.
middle name, Sara, or no? Just that?
Just
Okay.
Sara Soulati.
Okay.
Yeah.
I'm going to run your numerology on that sooner or later. I didn't do that yet, but
Please.
yeah. But I know you were born on the 9th, right? Your birthday's the 9th.
July 9th.
So you're a straight humanitarian because 9's a humanitarian number.
Yes,
So
you told me that.
yeah.
I'm in the right place.
Oh my God, you
Life.
definitely are. Yeah. When I was running your charts just briefly, I was like, what kind of wowed. You know, and I
Share.
Yeah. So, I will, but off camera.
Right.
But I mean the 9.
Finally.
The 9 is a humanitarian number. It's the last number.
Yes.
Before it switches to 10. So
Yes.
you
Which is the
definitely
humanitarian life path of helping people, which is interesting because that's what you do.
Oh, yeah. It's like I have to do it. It's
Yeah.
not that I chose to do it. No, I have to do it.
Mm-hmm.
Yeah. Why don't you tell us about your clinic and how you came to doing what you do?
Yeah, I mean, I started in this work in 1996. I was like 26 years old. I had gone into nursing. My father's a physician. My grandfather's a physician. I was supposed to be a physician, and I was hating the idea of being a physician. But I was like, okay, let's go into nursing and see what that's about. And it was a really big struggle for me because everything was pharmaceutical related and disease oriented. There was no prevention. There was no like curing of anything. It was just medication after medication.
Right.
And
Band-Aids.
I was kind of depressed, and I had to like lock myself out from that environment. Even though I was in the ER working in ICU, CCU, I was just like numb to what I was experiencing. And I was a vegan in 1989 when I was 19 years old. So for me to be a vegan and then not want to be in nursing but was in nursing, it was really challenging for me. There was an ad on the paper. There was this machine that had just come to Newport Beach, California. They had just finished the clinical trials. There were no other centers in the whole world except Stony Brook and this one clinic in Newport. I walked in, I saw the machine, and it was like love at first sight.
Wow.
And I stopped the nursing program. I stopped going towards physician assistant because I just got into the PA program, and it just made so much sense to me. I'm like, blood flow. Let's see how the human body can heal itself when we give it what it already has inside, and let us open it up and let us create a delivery system. And so this whole process started, like I mentioned, in 1996, and fast forward now, we're 23 years into it, and it's not the machine. It's just I have so much respect for this God-given human body that we have. It's so powerful. And I've seen miracles. I mean, I know people talk about, like, you know, they've seen people get better from this, you know, therapy or that therapy, but to see a patient that couldn't speak for 7 years start to speak.
Wow.
To see patients that were in wheelchairs for like 20 years, 24 years. I had a client that was in a wheelchair, Buddy Collette, very famous saxophone player. Couldn't play the sax, couldn't walk, came and did the program. He walked into the clinic.
Wow.
And we have it on our YouTube channel, him walking in, and he's like playing the saxophone. I mean, normally in life you don't go backwards. I mean, once you go from a walker, you go to a wheelchair, you go to the bed.
Right.
So we were taking people off the gurney into the wheelchair, into the walker with a cane. So I just, you know, became the observer, you know, and I just learned from the clients, really. It's like the clients taught me what this device was doing for them. So I really learned how to create really good assessments, good evaluations, pulling things out of people, like, well, you weren't like this before, and look, you can do this now, and bringing that awareness, because sometimes when people are sick, they can't even sometimes see when they're getting better.
Absolutely.
So I just became this cheerleader and this person that was an observer and just pointing things out, and my assessment skills became really, really good. If you've seen the device, you both have been on the device, I mean, we're tying you down. You can't go anywhere. So we're really going to get to find out what has been going on with you.
Great. So let's get into that. Like the device, people are probably like, okay, where are these guys? They're talking about these amazing stories, but what is the device? What's the name of it? And what is its primary function?
Yes. And the name of the treatment is EECP, and it stands for Enhanced External Counterpulsation. It was actually invented in Harvard in the 50s. So we weren't even born in the 50s, none of us here. And this is a device that was created for people that were having heart attacks. In 1995, it got its first FDA clearance to say that this device grows new arteries. Well, we were all here. It should have been front page news. Your body can grow new arteries. But no way did we hear about that, because this would take away so many pharmaceutical and so many surgical interventions. The way that the therapy works is you lay down on a comfortable bed, and 3 blood pressure cuffs are wrapped around the thighs, the calves, and the buttocks, and we have you timed to the EKG, and to the rhythm of the heart, these blood pressure cuffs start to squeeze the lower extremities and circulate the blood through the whole entire arterial system. So imagine what running up a hill can do for you if you were able to run it in a really fast-paced manner, with getting lots of perfusion of blood going through your arterial system, but without increasing your heart rate and without increasing your blood pressure. And that's what makes EECP different than exercise. And that's what makes EECP give your body the environment to heal itself, because even when your heart is sleeping at night, it's the only organ that works. Even when you're sleeping at night, it has to expand itself and it has to pull blood in itself. When you're on EECP, it's the first time we're taking the load off the heart. We're saying, hey, beautiful heart, we're just going to give you a rest for a whole hour, but we're actually going to circulate just like you would throughout the whole entire body. There's something that gets turned on in the human body and says, this is the time for me to grow new arteries because I have a blocked artery somewhere in my body, to reverse hard arteries. We were talking about age, before the show started. If we really want to know how old anyone is, we look at the arterial system. The older the arteries become, they become hard, stiff, and that's called arterial stiffness. Well, EECP makes the arteries bouncy and soft and supple, and it actually reverses the aging process. And so all of these wonderful things, stem cells come out of your bone marrow into the bloodstream when you do EECP. We lower the heart rate, we lower the blood pressure. but you get this mass perfusion of blood going through the whole entire system.
It's amazing. And I just wanted to touch on, we were talking about earlier, how many clients you have that are 90, even like 104, and people that are walking in and driving in on their own at that age is so miraculous and
well, we
wonderful.
all know that we're supposed to live to be like 130, 140. Really, we really are. And the medical system has always put us in this box and saying, well, you're 70 and you're old.
Right.
That is so young. To me, 70 is so young.
Yeah, totally.
I'm hanging out with 100-year-olds, and if you guys came in and you saw them, you would walk by them, you would never think they were 100. You would think, okay, these guys are 70 years old.
Yeah.
What these clients that have been with me for 15 years, and that's why I believe that EECP is designed for us to have it in our life. It's a lifestyle program. It's a lifestyle treatment. Just like how we get a massage, just like how we eat, detox, all the things that we do. Have something that gives you blood flow. Have something that rests your heart. Give your heart a rest and increase perfusion. The amount of perfusion that you're getting with EECP is beyond what you could do with exercise.
Yeah.
It's pretty
Amazing.
powerful.
Especially in today, I think it's such a fast-paced, multitasking, stressful environment we find ourselves in, the go.
Yes.
So I think it's absolutely, like you said, it's so instrumental in having that longevity and
Quality,
yes, longevity and quality
Yes.
of life, because we're like you said, we're just programmed, that person's 70-year-old and
this is the way I'm supposed to be. Right.
Exactly.
But
Not subscribing to that.
No way.
So with heart disease being the number one killer, right? So everybody watching this, it's obviously a preventative, but since it's a number one killer, it's a big deal. So how can that prevent and reverse the cardio disease of the heart?
Great question. And it's not just, for United States that's the number one killer. The whole globe, the number one cause of death is heart disease. And if you think about it, it's like, why is the heart attacking itself? Because it's really a heart attack. Look, it's like having an attack inside itself. People are focused on the arteries. They're saying, well, the arteries got blocked, so therefore the blood can't get to the artery. Okay, let's take that. EECP grows new arteries. Wherever you have a blockage, your body's natural defense to a blockage is to grow collaterals, microscopic blood vessels, that your body has this intelligence and recognizes that there's a pressure differential. Blood is going through this artery, blood is not going through this artery. I must want to create new pathways. And that's what EECP does. It forces the blood into the artery, and it has this incredible hormone that it pushes out of your artery walls, which is called vascular endothelium growth factors, which they've measured, and it spikes way high when you're on EECP. So it actually starts creating angiogenesis, the creation of collaterals. That's one notion. They say that there's a reason for heart disease. The new conversation today, it really has to do with the autonomic dysfunction, the conversation between parasympathetic and sympathetic, having this imbalance. And what you were just talking about, and you were saying that we're go lifestyle. We're living in this sympathetic lifestyle, especially in the industrial world. And now we're seeing heart disease attack those places that were villages before, but now they're getting industrial. Mm-hmm. And so the food starts to change, the stress comes in, and where is the balance of the nervous system? What's so great about EECP is, yes, we're going to grow new arteries, we're going to deliver blood through the arterial system, we're going to improve the organs of the body, but it actually balances the autonomic nervous system. That's why when you guys got off the bed, you could have felt this calm, relaxed state. That was the 100%. Nervous system.
And I had to go to the bathroom I went before I started, during, and after, which I just have to say, you know, because in Los Angeles, people love to lose their water weight.
Yeah, for sure. Oh my gosh.
So it's really interesting that you get on the scale, and when you leave there, you get off the scale, and
like 1 to 2 pounds.
Exactly. Yeah, it was so really interesting. So it's you can really gauge and feel the effect of it, and like you said, when you walk out of there, you feel light, flowy.
Those are the endorphins that you're getting pushed out of your own system, that you get that runner's high. Well, you're getting that runner's high with EECP. We just didn't tax your heart for it.
Mm-hmm. I love
makes
that.
a huge difference.
Yeah, it's so important.
It is. And what you were mentioning about the fluid coming off, so that's a huge lymph push. Mm-hmm. So I had no idea when I first started doing ECP. I'm like, why are people getting like headaches? Why are they nauseous? Why are they nausea? You know, having nauseousness on the bed, and it was because we were detoxing the lymphatic system. Pushing it into the circulatory system.
And that is so amazing, because you know the lymphatic system is so, I feel, blocked for so many people because of all the toxins and people and the deodorant and all the chemicals they're consuming and putting on their skin and breathing. And the lymphatic system doesn't really get penetrated as much as it should. So I didn't know that. That's amazing.
Yeah, that's what you were getting, is a lymph massage. So we treat a lot of people with lymphedema. We pump their arms underneath for women that had like lymphedema in the breast area. Mm-hmm. It's really incredible.
And speaking of, and I do you have a lot of people that have had breast implants and remove them and then want to clean their lymph nodes?
Yes, absolutely.
Interesting. That's really an important.
And not just that, and people with breast cancer, you know, during chemotherapy, we treat a lot of people because the chemo obviously is poison, and the heart gets really taxed. It gets elevated when that poison comes in, because the body's like, I got to get this out of here. Mm-hmm. So the heart keeps pumping really strong. And actually 87% of people that pass away from, cancer is due to a heart failure, because the heart fails because it's trying to constantly get this poison out. Right. So the heart becomes enlarged, and then it fails. Yeah. So we come in with EECP, we're like, let's help push this out. Let's lower your heart rate. Let's calm your nervous system down while you're going through this process.
So I have a question for you. So, I mean, everything, comes down to the heart, but just for people listening, all the different types of people, that come to see you, if maybe you could, list some of the people and their symptoms, like you said, like great for cancer, obviously people with cardiovascular issues. And you also have athletes come to you.
Oh yeah. When I was 26, I started seeing these 70-year-olds like come back in with, from the treatment saying, I just ran and I just walked this much, faster than before. And I kept thinking, maybe I should get on the machine. And I called Stony Brook in New York. They're like, no, this is for end-stage cardiovascular disease patient. I kept thinking, okay, well, logic tells me if they can do it and they're about to like die and they're fully getting better and they're living and thriving, what would happen to me? And so I strapped myself on the bed. I was the first person ever to probably get on the bed that wasn't end-stage cardiovascular disease. And I ran so fast that day in Newport Beach in Back Bay. I ran 6 miles. I started getting all my friends on the bed, and long story short, we took the machine to UCLA. We put it under the track and under the bleachers, and we treated Otto Bolden, Maurice Green, Quincy Watts. These are all gold medalists. Wow. And 100 and 200 meters. And I was able to see, here's a fine-tuned athlete. You can't really get more fine-tuned than the gold medalists. Their diet has to be perfect.
Yes, they're so strict.
And they ran faster. Their recovery was faster. They were able to, weight lift stronger. And every day they would come back. There came a time that they never felt fatigue. So imagine if you're going to work out for 8 hours a day, you jump on the bed, get EECP the next day, you're completely fresh as if you never worked out. So you keep upping your game.
The recovery, it helps repair the recovery
and people
process.
With injuries, imagine, what do we do when we have a broken something, a tear something? We ice and heat. We ice it to reduce inflammation. We heat it to bring the good blood. While you're on EECP, we're reducing the inflammation because we're circulating and we're delivering that good blood. So we were getting people out of the cast so much faster, getting out of the boot so much faster. And the great thing was that while they were doing EECP, we kept him in cardiovascular fitness. So it wasn't like they couldn't run, right? They have a broken foot. But 3 weeks, they did EECP. By the time they got out of the cast, they were like in the best cardiovascular fitness. So we definitely treat like, athletes. People are just that looking for the edge. People are looking to have a better quality workout. But we do treat people with heart failure, diabetes. We've treated people with stroke, Alzheimer's, dementia. Erectile dysfunction. There's a lot of clients that come in for that. And for me, it's just prevention and reversal.
And do you see a lot of, it helps with like a lot of chelation, like heavy metals? Because I would think when you're moving the body and you're moving the lymphatic system like that, it's going to help release all that from the body. Do you have people that come to you, clients that, and they say that, all of a sudden their heavy metals have dropped?
Really good question. When I first started, I started with almost the father of chelation, Dr. Julian Whitaker in Newport Beach. He was doing chelation in the 70s. He was doing supplements in the 70s. And he first started sending me patients, and he had chelated them, right? He had given them a big bag of chelation, and they would get on EECP, and they were peeing it all out. And I was like, wait a minute, you just wasted that whole entire bag in like 1 hour. You just got up like 5 times. So then we learned quickly, wait a minute, we're going to do EECP. We're going to open up the vascular beds. We're going to dilate the arteries. And then when they chelated them, it took in so much more. So they were so the doctor was able to see that the chelation faction of the body was able to be better because the vessels were open.
Makes sense.
So that was something that we kind of like stumbled on to ourselves.
I bet stem cells works. That took, because I mean I've been in that industry for a couple of years, and I know I know a little bit about it, and I mean that's like, I was big on like nutrition. I'm like, if you're going to take stem cells, you better be eating good and detoxing and stuff, so that way everything works in conjunction. But I mean, this thing forces it to move around, especially if you're going intravenous, you're going systemic, and this thing,
it's a delivery system.
The delivery system.
Yeah, and I was just gonna say, stem cells. After we mentioned chelation, stem cells is opposite. You get the stem cells, you come in and let us circulate, because it's not like that much volume like the way that a chelation bag would be. So actually we treat a lot of people that get PRP and then they get peptides and then they get stem cells and come in there and let us move that into the system. They just found out 2 months ago, we knew, but the medical system found out 2 months ago that the heart has so many progenital cells, which are stem cells, and they just thought up until like 2 months ago that stem cells were only in the bone marrow. And now they found out that the whole heart is full of stem cells. So when you're getting EECP, this is why I kept seeing the heart that was only pumping 17%, which normal is 65, after 35 hours, they went up to 60%. So I thought we were just getting stem cells coming into the heart, but we were regenerating the stem cells that were actually in the heart muscle.
And you got the exosomes, and I mean the juice behind the stem cells, which most people are kind of catching up on.
Yes, DNA.
Yeah.
Bring it on.
That's awesome. I love it. I mean, I figured that would be a case. It's just a piggyback, or at least their brother and sister.
Yes.
They definitely work good in harmony together. That's amazing. So, Sarah, can you tell us? What I really want to know is, can you give us an example of a patient that was extraordinary, that that really maybe came in pessimistic, was kind of like unsure, but walked out of there, and like just one of those grand stories that.
Unfortunately,
you probably have so many, right?
I'm just kidding. It's like all old men. I'm so sorry, but all old men come in and they're just like grouchy. But you know what? They've just lost hope. Okay, that's really what it is, because imagine you believe in the medical system and you did every single thing the medical system told you to do, and you did it, and then you come to a point and they say, there's nothing else we can do for you.
We hear that a lot. I mean, with all the interviews we do and the people we talk to, it's crazy how the pharmaceutical, it is. That's an epidemic in itself. The doctor's saying, you got 3 months to live. I mean, we have a friend that...
It's illegal. It should be illegal.
Absolutely.
Right?
It should be illegal. You don't know anything. Just give hope, because you know what? First of all, like 65% of placebo works. So what does that even mean? So that means we have a pharmacy in our neurons that activate what we need if we believe in it. So why don't you give me something, right? Yeah. I have had so many men clients that they're like, there's no way I'm going to do this. No, I'm never going to sleep on this bed. And they're like snoring away. I'm like, where's the video camera? So, I had one client that, he's actually on our YouTube channel. His name is Errol Abramson. And he shared his testimony with us. He flew from Vancouver on a private plane with a private nurse. He had less than 6 months to live. He had all arteries blocked, 90 to 100%, diabetic, peripheral vascular disease, meaning he had blockage of the legs. He had neuropathy. Wow. And he was maximum medicationed out. And he's a very wealthy man, very wealthy. So imagine you have all the money in the world.
And you're dying.
And the top doctors everywhere have said, get your life together. You're going to write your will, and there's nothing else you can do. So here he comes. He flies on a private plane with a nurse because he shouldn't travel. He ends up doing 2 hours a day, 6 days a week. He came from Vancouver, Canada, and he did it for 2 months. He changed to plant-based lifestyle, high, good fat diet.
Awesome.
And for the first time we met, he's like, what am I going to eat? I said, well, basically for the first 3 days, please nothing. Because whatever you've ate has brought us to this point here. So let's just cleanse and fast. And he went through the whole detox. His heart was 19%. After 2 months, he went back to British Columbia. This is in 2014, and his heart ended up at 65%.
Now, what do you mean by that? What do you mean by 19%?
So the normal heart strength, the ability to squeeze, it has to be 65 to 75. Gotcha. 65 is fantastic. You don't even want to be above 65. So that means the strength of the heart. His was at 19. And he couldn't, with all the money he had, he couldn't buy a heart or get a donor because he was too sick to even go through the transplant.
Jeez.
Wow.
So he went back and they did the echo and his heart went all the way back to 65%. The doctor picks up the phone from British Columbia University and he says, what is going on over there? I said, well, it's EECP. And I tried to explain to him, right, like what it is and how it is. You would think a heart doctor. He's a heart doctor.
Did he even know what it was? Or?
No, but he's a heart doctor. But why don't you care? Like, do you want this machine in your office now? Because here's someone that is totally living
proof.
Anyway, today's 2019, and I talk to Errol all the time, and he's still living. So it's
that's amazing.
No more diabetes, off of Lasix, which is a really strong medication for hypertension, and heart failure.
Wow, that's an amazing story. Incredible.
It's so good.
That has to be so.
Does he still come down to?
He comes once a year,
and
we squeeze him.
Nice.
So that's what we call it. We give him the big squeeze. So it's really cool. And we just finished taking care of this one guy. He was 38 years young. I say 38 years young because he had he didn't even have a heart attack. He had all arteries blocked and he did bypass surgery. And after bypass, he couldn't walk out of his bedroom. He flew from Virginia, and we're going to actually post a great video testimonial on him. He's now running uphill as fast as anyone you can do. He's videotaping, showing me he's at the gym, lifting weights, doing squats. I mean, he was getting chest pain putting on his shoes. At age 38, this happened to him. And at 42, they told him he needed a new heart. So he's good now.
That's really amazing. Good. That's so beautiful.
It is.
Wow. But it's like, we all have to bow down to the human body. I'm just standing here just saying, everybody come in.
Yeah, absolutely. Just like we were saying, for just to live a vibrant life, because just to be alive is not just enough. You want to be
do what you were put on the planet to do, and in the best way possible.
Absolutely. So speaking of, so this is this your mission in life? You feel, in your purpose in life?
Yes. I mean, I now know why I became a vegan at such a young age. Now I know why I went through nursing school, and I saw that side of like, okay, this is not going to work, and then there's no way that this is not like, guided from up above.
Absolutely.
There's no way. I just want to be a good student, and I want to be strong enough to be able to do what the universe is asking me to do, which is a lot, but I want to do it right.
Beautiful. And I love you're a vegan. I'm a fellow vegan over here, and Logan is plant-based.
For sure. Yeah. So what would you say, like, you know, I mean, you were saying it can, you know, reverse diabetes and erectile dysfunction. And I mean, I know erectile dysfunction because I know stem cells is a big contributor to erectile dysfunction. Do you have a lot of people coming in for that?
You know, they didn't come for that, but they never left. And I kept saying, what's going on? Because your heart's good. There's no longer hypertension. And the wives were like, listen, Sara, my husband's going to be coming there forever. But what was really fascinating for me, Logan, was that the 21-year-olds and the 14-year-olds were, when I was under that track, when I was telling you at UCLA, it was Friday night and they were all lining up. I'm like, what are you guys doing here? I want to leave. It's Friday. They're like, strong and long. We're here for Friday night. We want to get blood flow. I'm like, you guys are 21. Wow. And then I treated some NBA players, and then the wives started calling, saying, turn down the machine. This is too crazy. No, it actually becomes like really insane.
So it can become an addiction then, really. I mean, anything can.
Oh, yeah. No.
So you don't actually advertise for erectile dysfunction, but it helps in that.
Oh, no, we have it on our website just because so many people, like when you become hypertensive, that's the first thing that's also going to occur. And there's actually more collaterals in the groin area. How great is God? In the groin area than almost anywhere in the body, because it starts growing these microscopic blood vessels. You have to realize that if I took all of your blood vessels out, it would go around the planet 4 times.
That's crazy.
So there's so many tiny ones that we can't see, but when you're on ECP, we're pushing it through every single one of those little guys.
I love it.
It's so good.
I love it.
Really
I love it.
It's really good.
I'm like all motivated to come in. I'm like, what am I doing tomorrow?
Let's go in now.
Let's go now.
Yeah. Well, I was telling you that when I first met you, I had just finished a detox and I was on day 4 and I came in and I left there and I was like, my vision was so crystal clear and I could notice it, you know. I was like, wow. And then you were telling me, next time, you know, and then you were kind of giving me some pointers. So now I'm like ready to roll into another detox and take advantage of it.
And take all the supplements, you know, like take all the anti-inflammatory supplements and curcumin and, you know, anything else you take and jump on that bed and let it move.
So, and you were saying that guys that are doing hormone replacement therapy and they're taking testosterone, they come in after they do the testosterone because it pushes it through the body in a much more
dilation.
Formidable. Oh my God, that's
we're all gonna get off.
No, but it's just common sense when you really think about the diversity of this machine.
Right. There's so much we could do.
I have a couple questions. So, in terms of the average person who wants to just work on their health, maintain, would you say coming in once a month is effective for that?
No matter whatever timing you come in with EECP, every time you come in, you're going to detox. You're going to secrete endothelium growth factor. We're going to increase nitric oxide. We're going to balance the autonomic nervous system. We're going to vasodilate you. All of those things are always going to happen, even if you took one treatment and you never took it again, because that's actually the whole hour. That's what it's going to do. If you're wanting to, the question comes like, how could we improve your life, right? And say, well, I would like to be able to work out better. I'd like to be able to sleep better. Well, then we say once a week or every other week. So it really differentiates why you're there and what else can we do to enhance your life. But every time you take a session, it's all happening. But when you do so many, then there's this repair system that takes place.
I understand.
I mean, high blood pressure, 4 out of 5 people have high blood pressure. That means 4 out of 5 people are standing in line for a heart attack, stroke, kidney failure, right? Because that's the first thing that you say, how do I never get high, any of these diseases? Don't ever get high blood pressure.
And then they're staying away from salt, which salt is necessary. So it's like kind of a catch-22.
The good salt.
The good salt, of course. But they're everybody's like, no more salt. And then, you kind of, so it's like.
You need the minerals, but not the cutting your artery inflammatory salt. Right? So we have people that are in their 20s, they come once a month, once a week. Sometimes, they people that fly from altitude, they just get right from LAX, they land, they're like, let me get on that machine, because you feel so good when you get on the machine after you've
Helps
taken
with
a
jet
flight.
lag,
Totally.
long flight.
Yes.
Interesting. And so you have your places in Santa Monica, and I believe I heard you're working on a second location?
I have 2 locations.
two. Torrance, right?
Yeah, the first location is in Inglewood. I went straight into the heart of African American community because I was so passionate about heart disease. Is not it's not genetic, it's lifestyle. So I opened up the first center there, and then we opened up our second location.
I see.
But our goal is to go everywhere so people can have this.
So that was my next question for those listening. Do you know approximately how many machines are available in the United States?
There are 500 centers in the United States that do EECP.
Okay.
They only do it for end stage of life.
Wow.
So you're like
So
kind
this
of a
is my
rarity.
work. This is my work.
Why is that?
Well, because remember when the FDA cleared it, it said for end stage cardiovascular disease, and I decided to put myself on the bed. And I was working with Dr. Julian Whitaker, which was so progressive. He's like, I'm going to send you a Parkinson's. I'm going to send you a diabetic. I'm going to send you with renal failure. And he kept sending these people, and I kept writing down, like, what is going on? So this is my life's work, and that's why when you jump on the web and you punch in EECP, it always says angina, which means chest pain. Refractory means you can't have surgery.
Angina, yeah.
Very rare will you find a website that is going to mimic what I'm saying. It's very like maybe 2 or 3 doctors, and on top of that, not all machines are the same. So
I see.
Yeah. Your center is amazing. I mean, you go in there. So anybody listening, you go in there, and it's like you're kind of forced to meditate because it's so beautiful in there. The lights, it's so pretty. You get your own private dressing room to put your little pants on. You get to put on there. It's beautiful. It's comfortable. You can put headphones on. You can super zen.
A great chance to relax
Beautiful.
and meditate.
And your
you
staff
can use your cell phone. I don't recommend it, but for those of you who can't imagine giving up 40 minutes without their phone,
I know.
they are allowed. But I suggest meditation or reading a book.
Well, it's your own
personally.
heartbeat. I always tell people, I said, why don't you lay here and see how certain thoughts affect your heart? Because sometimes the machine goes really fast, and they're like, what is that? I go, what are you thinking about?
Yeah.
Let's talk about what that does for your heartbeat.
And you have your staff.
Your staff is super amazing.
Thank you so much. Well, it's really easy. I mean, when you
Shout out to Dean. I love Dean.
Yes. Oh my gosh, I love
and
Dean.
Josh and
Tony.
Tony.
Yes, and
all
Leilani.
great people.
Yes, I am blessed. I am. Well, when we get to help people and people really get well, it reflects back to us. I mean, we feel better too, so we get happier. It's not like the medical system where everybody is really unhappy, and you go to the doctor's office, they're sick too. So we try to live the life.
Exactly.
Awesome.
I love that. I love your soul, your energy.
Thank you
I
so
love your
much.
place and what
Thank
you put
you.
into it,
Thank you
and
so
the care and the attention and compassion you give to everybody
so
that comes
much.
through there is really extraordinary.
It's designed for the people. It's for you guys. It's for everyone to come, to share. This belongs to you. It belongs to the people. It doesn't belong to the medical system.
Yes, reclaim your health, reclaim your power. And I mean, that's what the Healers is about, is there are so many alternative things out there that people just are not aware of. We're just programmed, and we go to the traditional Western medicine doctor who studied years ago, and his education is, sorry, but it's outdated.
It is.
and it's also limited to that belief system and those textbooks that he studied through. And there's a global world out there of amazing medicine and
thank God for you
holistic
guys for the work that you're doing. To
it's
bring
all
this
about
to
raising
life.
your guys are healers, so we're all about healing the world through
so are
healers.
you.
And I mean, it's a joint effort, right?
Yes, definitely.
So amazing. So we're just about out of time. And so how can people find you at the best?
My
on social
original,
media, right?
my original company was called Global Cardio Care, and we just rebranded. But if they go on the web,
you can
Global
still find
Cardio
that.
Care, we can still find our YouTube channel, over 90 testimonials. Our new company for branding is called Solaire, a wellness company.
Nice.
But Global Cardio Care, you can find.
I'm going to put them on the. You're going to have them. Everybody's going to see them flash on the screen anyway. We'll make sure you put your YouTube channel.
And people can come and try a session out complimentary. I want
that's awesome.
people to come.
Free session. Your first session's free, man. You can't beat that.
Yeah.
You can't beat that experience.
We
right
love
there.
to help people at the Healers. So there you go.
Yeah.
You have
If you're
nothing-
detoxing, if you're a diabetic, if you getting stem. I mean, especially stem cells. We're going to talk because I have a lot of contacts, but you're spending $5,000, $6,000, $7,000 on stem cells. Your treatment is so inexpensive, and it's
that's the difference between some people's stem cells don't work and some people's do. It's because they didn't have that mechanism of the push that the body needed.
Needed the push, man.
Yeah. And we've got the push.
It's like cereal without the milk, man. Of course, we're talking about almond milk, though, right? So,
that's right, and we're talking about non-cereal that's carbohydrate.
Maybe oatmeal muesli or something.
Hemp granola. Yes.
All right, so there you have it, ladies and gentlemen. So you get a free complimentary session at the center, and
highly recommended.
Absolutely, I'm probably going to come tomorrow. So
please, both. Put you guys in a private room.
I'm due for mine. So you have 8 beds in the one in Santa Monica and 20 in the one in Inglewood.
Yeah, we are squeezing the African American community. They're all turning vegan. It's like it's a love festival
beautiful
in there.
I love it.
It's so cool.
I love it. Thank you for your dedication to helping people. You're really
true humanitarian,
beautiful.
man. Straight up 9. I love it.
True healer. True healer.
Tell me about that.
Are you familiar with the tarot cards? You know tarot cards?
Yes.
So your tarot card, one of your tarot cards is the Hermit card, which is the old man on the mountain, the sage, the wise one.
We're gonna do her whole reading after.
Okay. Well, yeah. I'd love to give you a reading. Yeah.
Thank you for listening to the Healers.
Thanks for listening to the Healers, man. It's been a great session. Thank you for coming on. We appreciate it, and we're gonna definitely have you on again.
Yes.
So
anytime. Big love to you both. Thank you so much.
Yeah, hey man, it's been a pleasure. Thank you so much. So my name's Logan.
I'm
lovely Gabrielle, and our beautiful guest
Sara,
and that's all we got for tonight. Thanks for joining the Healers. Good night, everybody.
Bye.